You wouldn't want Elizabeth Wettlaufer to look after you or your elderly relatives. Why? Because she was a bad nurse, an addict, and a serial killer. On the 16th of September 2016, Elizabeth Wettlaufer, a 49-year-old registered nurse in Canada, presented herself to the Centre for Addiction and Mental Health, CAMH, Psychiatric Hospital in Toronto, Canada. She stayed there till the 5th of October, 2016. While there, she confessed to murdering 8 patients under her care. This made her one of the most prolific serial killers in Canadian history. Let's examine what she admitted and what was discovered while she was a psychiatric inpatient. Later, we will explore her interrogation, sentencing, and what followed. A discharge summary completed when she was discharged is the basis for much of the following information. On admission, she informed the psychiatrist that she had been providing intentional overdoses to many of her patients over the past 10 years, including her belief that these overdoses resulted in 8 deaths. She also stated that she had been struggling with increasing depression and suicidality over the past several months. She stated that due to her inability to control her urge to provide insulin overdoses to her patients when very distressed, she could no longer work as a nurse after her employer suggested she start working with children/adolescents with diabetes in Woodstock. She stated she initially drove off to Quebec with the intention of escaping her life, but then decided to turn around and face her actions. She came to CAMH in Toronto for help, after reading about the services online, including noting that CAMH did have a forensic service. She was admitted and held involuntarily to prevent her leaving while her confession and its consequences were explored. Chain analysis was performed to better understand the sequence of events, thoughts, feelings, and behavior leading up to Wettlaufer intentionally overdosing a patient with insulin. Chain analysis is a technique used in dialectic behavior therapy, otherwise known as DBT. DBT is a treatment for individuals like Wettlaufer who have difficulty managing intense emotions. It is frequently prescribed for those suffering from emotionally unstable personality disorder, EUPD, commonly known as borderline personality disorder, BPD. In this case, the chain analysis would show the vulnerability was Elizabeth's poor coping skills and her addiction issues. The prompting event was when a patient behaved in a way which she found distressing. Links were actions she took, bodily sensations and thoughts she had, events in her environment and feelings she experienced between the prompting event and her problem behavior. The problem behavior was administering an intentional overdose. The consequences then were the results on herself, those she overdosed and others around her. However, she did not clearly meet criteria for any one particular primary anxiety disorder. While she had many symptoms and behaviors associated with anxiety disorders, she did not have enough to meet the criteria for being diagnosed. This is common in patients with borderline personality disorder. Elizabeth spoke openly about her long-standing struggles with both alcohol and opiates and had periods of sobriety at varying times. She admitted to frequently stealing hydromorphone, an opioid, from her patients' medication supply. Much of this behavior seemed to have worsened since her husband left her 10 years ago, but this behavior was present prior to her marriage as well. Elizabeth had significant symptoms of borderline personality disorder, including significant mood instability, impulsivity, fear of abandonment, unstable relationships, and anger. The diagnostic criteria of borderline personality disorder, according to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, are as follows: a pervasive pattern of instability of interpersonal relationships, self-image and affects, and marked impulsivity beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. 1. Frantic efforts to avoid real or imagined abandonment. 2. A pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. 3. Identity disturbance, markedly and persistently unstable self-image or sense of self. 4. Impulsivity in at least 2 areas that are potentially self-damaging, for example, spending, sex, substance abuse, reckless driving, binge eating. 5. Recurrent suicidal behavior, gestures or threats, or self-mutilating behavior. 6. Affective instability due to a marked reactivity of mood. 7. Chronic feelings of emptiness. 8. Inappropriate, intense anger or difficulty controlling anger. 9. Transient, stress-related paranoid ideation or severe dissociative symptoms. She had many symptoms consistent with antisocial personality disorder, as documented in the notes. However, in reviewing her childhood and adolescent years, it was unclear if she fully met criteria for conduct disorder, especially prior to age 15, despite there being several episodes of oppositional behavior, including running away from camp for one day and pulling the alarm at school intentionally to make a situation more difficult for a teenage boy whom she did not like. To diagnose antisocial personality disorder, the following criteria must be met according to the DSM-5. 1. The person must have excessive egocentrism and goal-setting based on their own desires to the detriment of society and adherence to laws, as well as lacking empathy and difficulty maintaining healthy, intimate relationships. 2. They should show evidence of manipulative, deceitful, and callous behavior with frequent angry and hostile behavior towards others. 3. They should show evidence of irresponsibility, impulsivity, and excessive risk-taking. 4. The individual should be over 18, and these behaviors shouldn't be better explained by their culture, developmental stage, or as a result of medical illness, or the influence of drugs. Elizabeth was repeatedly very clear that she came to hospital to talk about her actions, to get help, and to eventually speak to police about her actions. She also did not feel confident in reporting her actions to police on her own, for fear that she would not be believed, or not get the support she needs, including her medication, if she were to be put in jail. Elizabeth was very clear that she has told various contacts over the years about her actions, and has still not been able to stop after telling them, including a lawyer, a priest, and a sponsor from Alcoholics or Narcotics Anonymous. She came to CAMH to talk openly about her actions, get the help she needed, and become better prepared for the eventual reporting of her actions to both the police and College of Nursing. Throughout her admission, her capacity to consent to releasing of information was repeatedly assessed, and she was, at all times, found to have said capacity. Dr. Khan also recommended to Elizabeth that she obtain a lawyer to assist her with her confession. Elizabeth responded that she will get a lawyer when it is necessary, but believed that a lawyer would just tell her not to talk anymore about what she had done. Elizabeth explained that she had difficulty dealing with the anxiety, irritation, and frustrations of both her personal and working life, and that alcohol and opioid abuse helped her cope. Discharge diagnoses. 1. Antisocial adult behavior. It is a strange phrasing to say she has behaviors but not explicitly state she has the disorder. It may be that the lack of conduct disorder prior to age 15 made them unsure of the diagnosis. 2. Alcohol use disorder. Binge type, mild severity. 3. Borderline personality disorder. 4. Major depressive disorder, recurrent, no evidence of a clinical major depressive disorder during the admission. 5. Opioid use disorder, mild severity. Medications at discharge. 1. Fluvoxamine, 200 mg daily orally. This is a selective serotonin reuptake inhibitor used to treat depression, OCD, and some anxiety disorders. 2. Quetiapine, 300 mg daily orally. This is an antipsychotic which also has a role in reducing anxiety, treating bipolar disorder, and occasionally depression in conjunction with antidepressants. 3. Loxapine 25 mg is required, but no more than every 4 hours, for anxiety. This is an antipsychotic medication which is useful in reducing anxiety. 4. Hydrochlorothiazide, HCTZ, 25 mg in the morning orally. This is a diuretic medication causing individuals to pass excess water in urine. It is used to treat high blood pressure. 5. Ramipril 2.5 mg in the morning orally. This medication is used to treat high blood pressure. Discharge disposition. 1. Discharge home. Woodstock detectives are driving her back to Woodstock, will question her, and then will release her pending further investigation of her claims. 2. To be followed up by her general practitioner and psychiatrist if necessary. 3. To be provided with prescriptions for her medications for 16 days. Detectives from Woodstock picked her up and drove her to their station. There they interviewed her about the murders she had confessed to in hospital. Let's take a look at the police interview now. The detective interviewing Wettlaufer applies the Reed interrogation technique. I'll assess the interview through that prism as well as my clinical experience in psychiatry and forensics. I should remind viewers that I have not personally assessed Elizabeth Wettlaufer. Therefore, while my opinions are informed by my clinical and forensic experience, they are not intended to diagnose anyone. Take a few seconds to look at the image we've paused at. There's a wealth of information here. What do you notice about Wettlaufer? About the room setup? About what's on the tables? Let's analyze Wettlaufer first. She is a middle-aged, overweight lady. She is casually dressed, reasonably kempt. She has brought a water bottle and handbag into the interview with her. She has an analog watch on her left wrist, usually a sign of right-handedness. The watch is worn facing outward. Wearing a watch facing inward is common in ex-military or police, and those worried about the privacy of their smartwatch faces. She is wearing a hospital identity bracelet on her right wrist in keeping with the fact that she has just been discharged from hospital. She is facing towards where the interviewer will sit, but, more specifically, their notes and pen. She is looking at the pen and paper and engaging in an adapter behavior, specifically of the grooming subtype. These are nonverbal gestures and movements that help people deal with anxiety. In her case, it is a self-soothing behavior to deal with her anxiety. The room is a typical interview room set up according to Reed's interrogation recommendations. It is approximately 10 feet by 10 feet and arranged so that the camera can see the entire space available for Wettlaufer to sit or move in. The camera is arranged well above eye level out of line of sight of Wettlaufer and the interviewer. There are no drapes or other possible areas of concealment which could make Wettlaufer fear that there are others in the room. This promotes a sense of privacy, which is conducive to disclosure. The third chair in the room is for an observer, or second detective. It is set off to the side so that it won't interfere with direct line of sight and eye contact between the interviewer and Wettlaufer. The chairs are all straight-backed and comfortable, but not too comfortable. They aren't padded or reclining chairs. Wettlaufer's and the detective's chairs are placed about 4 feet apart, with no intervening objects, and at roughly the same eye level. Wettlaufer is in the room alone, on some pretext in order to let her stew a little. All of this is intentional and planned in order to set a tone conducive to interrogation. Let's compare this room to an example room layout from Essentials of the Reed Technique, Criminal Interrogation and Confessions by Fred Inbow. If you are enjoying this video and want to let us know you want to see more videos like this, hit the like button.
That's okay.
Too many people moving and shaking around here, you can't really keep track of who's doing what. So yeah, like I said, I'm just going to go through for everything in this room is audio and video recorded first off. You're okay with that?
Oh, yeah.
Okay. So I just want to go through, like I said, a couple formalities, cover a few little things off, things that I have to do on my end that I need to do, and things that I just want to tell you and make sure that we're all on the same page before we get going.
Okay.
Let's examine Wettlaufer's verbal, paraverbal, and nonverbal communication. This is important in establishing her baseline level of behavior. We use this baseline to compare against future changes in behavior. Wettlaufer has relatively normal rate, rhythm, tone, and volume of speech. She maintains good eye contact with her head, torso, and legs, facing the detective. She exhibits an open body posture, but quite limited spontaneous arm and hand movement. The detective is professionally dressed with no outward signs of police rank, gun, handcuffs, or anything which would remind Wettlaufer that this is a police interview.
Okay. So, first off, today is Wednesday, October the 5th, 2016, and on my phone right now, I'll just use that as a time reference, is 5:14.
Okay.
So 17:14, we'll just use that as a start time of our conversation here today. Again, my name is Nathan Bergott with the Woodstock Police Service. I currently work in our crime unit.
Okay.
And we met a short time ago in downtown Toronto, correct?
Yeah.
Right.
Yeah.
So we came to a facility where you've spent the last few weeks, from what I understand.
Yeah.
And we met with Dr. Khan and his team of associates, and I believe you were under his care for the last little while, correct?
Yeah, the last 3
The detective establishes that this is an interview, not an interrogation, and that Wettlaufer is free to leave or ask for a lawyer at any time. An interview is a free-flowing, non-accusatory meeting used to gather information and establish interviewee behavioral baseline and credibility. An interrogation is an accusatory interaction designed to persuade suspects to tell the truth. Wettlaufer came in with the stated intent of confessing to 8 murders, so an interrogation isn't necessary. Note the use of non-confrontational language such as,
In our company.
this is intended to underline how non-threatening things are.
Okay. And the process, how we got here basically is kind of offered you a ride back, and so we could have this conversation, and you gracefully accepted, and off we went down the 401, or the Gardner, the QW, and the 403, and here we are, right? So just to make it clear for whoever might watch this in the future, we didn't force you to come with us. We didn't, shove you in the car and off we went kind of thing. You did it on your own free will, and you accepted it on your own on your own decision making.
Yeah,
Is that
no.
correct?
Yep, I had enough, and he even let me try to give money to the homeless people. So.
Wettlaufer uses this time to begin establishing her narrative of being a nice person and wanting to give money to the homeless. A person who may have made mistakes or been under some influence, but wouldn't do these terrible things of her own volition. We'll see this narrative throughout the interview.
There you go. I remember all of that. So I know I read you a few things before, as we were kind of just cruising down Spadina there. And I know you've been read this many times, but it's just things that we need to just reiterate and make sure that you're clear and comfortable with having this conversation today.
Okay.
Okay. Like I said, based on our investigation, there could be some pretty serious criminal charges that result of our investigation. Okay. Yeah. So having said that, if you wish to speak to a lawyer at any time, I don't want you to hesitate. We can make it happen whenever you like. So whether it's now, 5 minutes from now, an hour from now, or 3 days from now, whatever the case may be.
We're not going to be asking questions for 3 days, are we?
I hope not. No, I hope not. I'm just saying that any time that you want to speak to a lawyer, that you're kind of in our company or whatever the case may be, you let us know. We can make that accommodation for you. Does that make sense?
Yeah.
Okay, because in your position as a Canadian citizen, you're entitled to have free legal advice from a legal aid, duty counsel lawyer, a lawyer of your choice, whoever you like.
Okay.
Note the hesitation just before he says, a Canadian citizen. I bet he was thinking of saying suspect, but went for the more neutral and less threatening Canadian citizen.
Make sense?
Yeah.
And like I said, because there could be some criminal charges that the result of our investigation.
Now the detective establishes Wettlaufer's right to stay silent, and that anything she says can be used in court against her.
Right.
Okay. Also, and I know you've been read this many times before, that you may be charged with many criminal offenses, and you don't have to say anything in answer to the charges that you face. But if you wish to do so, we're going to do that today. But whatever you do say could be used in courts. And I know we had that conversation in the car on the way back to Woodstock, and I asked you to repeat it in your own words, and you kind of gave us a few of describing it in your own vocabulary. As you said something like, it's not Vegas. What happened in the car on the way back doesn't necessarily stay in the car. Right?
Yeah.
So same thing this room. Anything that you say and everything that we talked about should be used as evidence at court.
Yes.
Okay?
Okay.
So kind of, to put it easily, the same rules apply. Okay? And if you've spoken to any other police officers, I know that you've dealt with the Toronto police officers. Yeah. There was a couple officers in the car on our trip back here. If anyone's persuaded you or tried to push you into making a statement, whatever they said, I don't want that to influence you in any way. Okay?
No, what I'm about to say, I'm giving up my own free will.
Okay. All right. And I appreciate that. And we'll get moving forward. For another few things, and I know that we said this in the car, you are not under arrest right now.
Okay.
Okay, I want to make that very clear to you.
Okay.
Okay, you're not under arrest. The door is unlocked. Okay, I'm not impeding your way to the door. If you want to leave at any time, if you want to stop talking to me at any time, you just let me know, and we'll just carry on from there.
Okay.
Okay, but you're not being held here against your will. We're not forcing you to speak to us. We just have some follow-up, some follow-up questions from the investigation that kind of got going while you were in Toronto. That's kind of all formalities, but like I said, those are the things that I just wanted to make sure that we're clear to you. And if you have any questions for me before we get started, the floor is yours. If there's anything or any concerns that you have.
No, I want to get through this and find out what happened to my mom and dad, because I know they're...
The detective has finished establishing the legal criteria that this is not an interrogation, that Wettlaufer is free to leave, get a lawyer, and end the interview at any time. Now we move into a rapport-building portion of the interview. The detective communicates politely and respectfully. He makes it clear that he empathizes with Wettlaufer by saying he can imagine her situation, and invites her to identify with him also.
That because someone went to visit them today.
Okay. And
I visited them today, and they said, you know, if they're here, we're concerned, what's going on.
Yeah. Oh, I can imagine. I honestly don't have those answers for you, but I can get them for you.
We have a nice piece of mutual rapport building here where they joke about the purchase and price of tickets for a sports team.
Okay. You know what? If I could afford them for the playoffs, I probably would have. Yeah, that was exciting last night. So just for the record, and I know you prefer to go by Beth is what you told us, is that correct?
Now he establishes and will utilize her favorite mode of address. This is further rapport building. Start. And now we kick the fact-gathering portion of the interview off.
Can you just state your full name for me?
Elizabeth Tracy May Wettlaufer.
Tracy May?
Yep.
Okay, and just spell your last name for the record.
Wettlaufer.
Perfect. And Beth, the reason why we're here today is because we received some information back at the end of last week with regards to some information that was provided to the Toronto Police Service, which has led us into quite a bit of work, and we was here today to speak to you with regards to kind of how this all started and follow up. But basically, I've watched your statement that you provided to Toronto.
Okay.
Okay. And we've been provided this document here. Does that look familiar to you?
Yeah.
The detective introduces her written confession. He references
People that you've encountered in your career.
This is an extremely neutral way of saying people you've murdered.
All right. And from what I can see here, there's 4 pages of a handwritten document. Is that your handwriting?
Yes, it is.
Okay. And it just kind of goes through some people that you've encountered in your career from 2007 through to 2016 of August.
Yeah.
August of 2016. Okay. So that's kind of the focus of our investigation right now, is the information that you put on these 4 pieces of paper.
Yes.
The detective starts getting a longitudinal history, the timeline of events. This is a good next step as it is non-threatening. It also establishes a pattern of question and answer which can be helpful when questions become more challenging later. Humans are creatures of habit, so establishing useful patterns early on in an interview or interrogation is useful.
Okay. But before we get into that, I just want to kind of get an idea of your career and where you've been in your career and kind of how you got into things.
I started from here in Park Secondary School. I graduated grade 13, went for a year of law school. Not law school, sorry, journalism school.
Okay.
And then went to Bible College, London Baptist Bible College in London. Graduated with a degree in counseling. It's a bachelor's degree in counseling. And then discovered that that's not gonna be really gonna get me a lot as far as work-wise and career-wise, and so I went back to Huron Park High School for a year, and I took a year of math and sciences and went on to Conestoga College it's in Kitchener, but they have a Stratford campus, so I went there for the 3 years.
Okay.
And then when I graduated there, I worked in a place called Geraldton.
Okay.
Which is 16 hours north of Toronto.
I was going to say, it's quite a bit north, isn't it?
3 hours north of Thunder Bay.
Yeah, that's way up there.
Yeah. Worked there, couldn't stand the isolation, moved back. Worked for an organization called Christian Horizons here in town in one of their group homes till 2007, at which time my marriage fell apart in February 2007, and I met a woman online, and she decided to move to be with me.
Okay.
Wettlaufer says her marriage fell apart, and she
met a woman online, and she decided to move to be with me.
Okay.
This is incorrect. Wettlaufer was already meeting women online long before her marriage fell apart. She is managing the narrative and dishonestly aiming to avoid personal responsibility. This is very typical for those with antisocial personality disorder and borderline personality disorder. Note also the discrepancy between her below-average level of fidgeting and arm movement and the walking around when agitated.
So I ended up quitting the job I was at and going to correctional care to make a little bit more money because I was the only bread earner. So I started working at correctional care, I believe it was June 2007.
And how long did you work there for?
until 2014. Yeah, till like I think it was March 2014.
And were you always in the same role, or
As
did you do different roles at Crescent Care?
I was a registered nurse.
Yeah.
And registered nurse's role was always the same.
Yeah.
But I worked in different areas of the home.
Okay.
There's 5 wings to Crescent Care, so I worked in different areas.
Right. Okay. All throughout the 7 or so years that you were there.
Yeah.
Okay. And at that point, did you have different supervisors from unit to unit, or
No, there was
the same person, or?
There was one supervisor, Helen Matheson, she was the head nurse.
Okay.
And then there was like people under her, Shelley, Jeanette, I don't remember the rest of them. Then there was like an administrative head. And I think for most of that time it was Brenda.
Right. Okay. And then from Crescent Care, I know you've had a few other.
Yeah, I went from Crescent Care, fired from Crescent Care.
Okay.
For a medication error.
Wettlaufer again gives out very little nonverbal information. However, the fact that she misstates error on 3 occasions is very telling. Discussing her medication errors is a very stressful area for Wettlaufer.
Yeah.
Then from there I went to Meadow Park Nursing Home.
Okay.
And left there. I knew they were going to die.
Yeah.
And it was just an opportunity to give the family a rest.
Yeah.
The detective now lays on the praise again to keep Wettlaufer talking. She buys it as shown by the change in her tone and her more animated hand gestures. Wettlaufer loves praise. This is very common in individuals with borderline personality disorder. Praise can help challenge the inner voice which constantly says they're not capable or good.
Absolutely.
So.
Yeah, it's an important role. I mean, a lot of people wouldn't see it that way and wouldn't even notice the care that these people are giving from people like yourself, right? You would give the families a bit of a break and take that role is important, like which a lot of people don't see, right?
Because when someone's dying in the house, families don't want everyone to be asleep at once, right? And that can be very hard if you're not able to do that.
That's right.
But if you have a nurse there that says, no, it's okay, I've got this, I know the medications they get, it's going to be alright, then.
One kind of rest easy. Back at Meadow Park, what was your addiction?
Hydromorph.
Alright.
Hydromorph.
Okay. And how much were you using? And
I was a binge user, so I would use what I could get a hold of.
Okay.
By stealing it from the patient.
Okay.
The detective now leads with a very open-ended question.
What was your addiction?
This gives Wettlaufer the option of approaching the answer in whatever manner is most comfortable for her. Note the temporizing phrase, followed by a head turn and a version of gaze before Wettlaufer names hydromorphone as the drug she abused. The verbal, paraverbal, and nonverbal channels all scream shame about her drug abuse. Hydromorphone is an opioid for the management of severe pain. It is highly addictive even at therapeutic treatment doses. The risk of addiction is increased when there is a past history of addictive behavior or mental health issues, such as depression or borderline personality disorder, both of which Wettlaufer had. If you're interested in reading more about hydromorphone, we have provided a link to a Health Canada pamphlet in the description.
All right. And how would that work? Would it just be in their allotted medications, or would you have access to a card to feed your addiction?
There's some of their allotted medications. Some of them had confusion, so they couldn't tell the difference between what pills you were giving them. So I could give them a laxative instead of their hydromorph.
Okay.
So apart from murdering 8 people, Wettlaufer also caused many others pain and suffering by giving them laxatives instead of their correct medication.
There was a lot of them had as needed, so it would be in a big card, and then they'd say, I would just punch out that, oh, Barney needed 2 of those today, and oh, Billy needed 3 of those today when they really didn't.
Okay.
And that's how I would get a hold of it. Okay. Every once in a while, there was also a big drug holder, like a safe almost, that we would put the drugs in.
Okay.
Once somebody died,
yep,
and there were like 23 hydromorph left, would slide the whole card into the drug holder. Well, if you picked it up and turned it upside down and shook it, you'd get drugs back out of it.
So you had your ways.
Yes.
Yeah. Okay. And was that ever an issue with Detler? Were you ever confronted, or did that go totally undetected for the time you were there?
There was a time when hydromorph was delivered to the home, and it didn't get put away right away by the person who should have. And so I took the hydromorph and put it in my bag and took it home, and it wasn't discovered for months.
Okay.
And so I just played dumb. When the police told me about it, I played dumb.
Yeah. And that was that.
Wettlaufer stole medication in 4 ways. Firstly, by saying she gave 3 hydromorphone tablets, but only giving the patient 2, and pocketing 1 for herself. Secondly, by taking leftover hydromorphone when patients died. Thirdly, by intercepting the delivery of hydromorphone from the pharmacy. Lastly, by giving the person laxatives instead of hydromorphone. This pattern of use, treatment resulting in short-term abstinence and then relapse when exposed to the stressors, is very common.
Yeah.
So as a binge user, then, like, how much would you be using on a? I mean, obviously, you wouldn't use it on a daily basis if you were binge using, but like, how long did the addiction last for?
Oh, the addiction lasted from, I think, started in 2008. So to 2014, at which time I went away and got treatment at a treatment center.
Okay.
But then I started using again, probably January 2015. I started using again.
What do you think the reason is that you slipped into the addiction back in 08? Like, what was it just the stresses of the job that you were facing, or dealing with your personal life as well? And
Wettlaufer now outlines how stressful her job was and how interpersonal stressors led her to addiction. Note the lack of acceptance of personal responsibility here. We'll see this a lot throughout the rest of the interview.
Just always feeling like I had to be the best possible person, and very, very stressful job, giving medications to 32 people, making sure treatments were done on 32 people, charting for 32 people, supervising 4 PSWs who sometimes didn't always get along, and sometimes didn't always get along with me. It's a hard job. Any nurse will tell you it's a hard job.
I believe it 100%.
And then they would add different things like, oh, you have to do this and that to say who's here, and counting the medications at the end of the shift, and it was a hard job. And I always was putting this pressure on myself to be a really good nurse and to do everything perfectly. And every once in a while, when I could get a hold of a hydromorph or 2 and take it, then that pressure was gone.
Right.
This is quite a common narrative among patients presenting with a non-castic personality disorder, otherwise known as obsessive-compulsive personality disorder and borderline personality disorder. They often set unrealistically high expectations for themselves. They don't realize that their level of functioning is quite low, and they have no chance of meeting those expectations. They then become overwhelmed and distressed as they fail to meet those self-imposed expectations. That distress drives self-destructive behaviors such as addiction. Her fantasy narrative is of trying to be the perfect nurse, while the objective reality is that she intentionally killed at least 8 patients. The detective now takes a 2.5-minute detour to discuss her relatives and where Wettlaufer received treatment for her addictions. This segue is designed to bring her anxiety levels down before moving on to more anxiety-provoking topics.
So as far as your latest position at St. Elizabeth, that was your last position as a RN, is that
yes,
correct?
It was.
Okay.
Yes.
And you said you resigned from there?
Yeah.
Okay. What brought you to that?
That's where things get a little crazy.
Okay.
This is part I haven't told the doctors.
Okay.
Because it seems so stupid now.
Before watching the next section, let's remember that people with antisocial personality disorder seek to avoid personal responsibility for issues. They are always scanning for reactions and adjusting what they say to their audience. They want to manage how others perceive them as much as possible. Here, Wettlaufer raises an issue she admits she hadn't told her treating psychiatrist, namely a voice which she says influenced her to kill. I believe she didn't raise this with her psychiatrist, as we are trained to be able to differentiate between psychotic voices and those which originate from within the individual and are not signs of psychiatric illness. A detective would find this differentiation much more difficult as their expertise lies in different areas. Wettlaufer talks about murder and responsibility avoiding terms twice when she says,
different times that I have caused people's death and helped people to die.
She is seeking to distance herself from the reality of murdering elderly patients in their beds through her use of language. Semantics don't change the objective reality of what she did. These sorts of word games, to avoid taking responsibility for one's actions, are common in individuals with antisocial personality, borderline personality, and narcissistic personality disorders. Note also when she says,
the voice said inside me, I'll use you.
This appears to reference passivity, a psychiatric symptom common in schizophrenia, where an individual experiences their body and mind being controlled by another. They remain aware of what is happening, but it feels to them as though another has remote control of their body. That other can make their body move and their mind think and feel whatever that other person wishes. This would be a cornerstone of an insanity defense if she decided to go that route.
When my ex and I broke up in 2007, I was already taking the medication for my borderline personality disorder. And I was so angry. And it was like a voice said inside me, I'll use you, don't worry about it. And the different times that I have caused people's death or caused them discomfort through the influence, I believe it was the influence of that voice or whatever it was. It wasn't a voice in my head, it was a voice in here. And when I would do it, afterwards I would hear like a laughter in my chest. So, started working for St. Elizabeth, and I was doing well, but it was a lot of pressure. And the way that, that I've helped people to die has been through insulin. And after my 30-day evaluation, my supervisor came to me and says, I'm really sorry. We wanted you for Woodstock, but we have so many kids through schools in Ingersoll that need help with their insulin pumps that you're going to start working in Ingersoll. And I panicked. I didn't want to do that. Because I thought, what if? Those are kids. So it was about a week after that I quit.
Note the change in inflection at
and I panicked.
And the tapping of the hands on her thighs. Her paraverbal and nonverbal channels are signaling the distress she reports verbally at the thought of being transferred to treat diabetic children whom she is certain she would murder if they distressed her. This signals that she is telling the truth here.
I didn't want to hurt anybody anymore, so I also quit my other job. And then I decided, whatever Friday that was, that I did a lot of looking into how I could get help, because I realized I needed help with whatever this was.
Right.
Because part of me had started to believe that it was the devil, and part of me thought it might be God looking purpose through my life. And I know the doctor asked me those questions, but I didn't answer them because I was so ashamed.
Right.
Because part of me had started to believe that it was the devil, and part of me thought it might be God looking purpose through my life. And I know the doctor asked me those questions, but I didn't answer them because I was so ashamed.
She isn't being truthful here. Her verbal channel says she was too ashamed to tell her treating psychiatrist about psychotic symptoms, despite being perfectly happy to tell the same psychiatrist about the 8 murders she committed. Immediately, this doesn't make sense. Throughout the video, when she talks truthfully about shame, there is a change in tone of voice and rate and rhythm of speech, the paraverbal channel, as well as gaze and head aversion, the nonverbal channel. There is no aversion of her head or gaze until after she finishes pushing her shame narrative. She employs forceful hand chops of sincerity at key points of her story, particularly when she mentions the devil, God, and shame. Her paraverbal channel doesn't deviate like it does when she is being truthful. While we all have access to all of the nonverbal signals available to everyone, we tend to favor a small subgroup of these signals, These are our personal tells. Wettlaufer just loves what I've taken to calling the hand chops of sincerity to signal truthfulness. She does this even when she is lying. In fact, especially when she is lying. More often than not, when Wettlaufer employs the hand chops of sincerity, it telegraphs lies. She employs single hand chops at times which are more likely to be subconscious and truthful movements. When she really wants to signal sincerity and truthfulness, she brings out the double hand chop of sincerity, which is almost always a sign of untruthfulness. Let's rewatch her attempt to sell her narrative and just focus on her gaze, head direction, and double hand chops of sincerity as they relate to the narrative she is spinning.
But I didn't want this to keep going on, so I quit both jobs. Looked into where I could get help. Dr. Fernando is my psychiatrist, and he's not a very nice man.
I'd be willing to bet that she thinks Dr. Fernando isn't a nice man because he sees through her narratives and doesn't let her shirk personal responsibility for her actions. I frequently have patients with antisocial personality, borderline personality, and narcissistic personality disorders become angry with me and say much the same thing. This invariably occurs after I remind them that they are responsible for the consequences of their behavior and can't endlessly shift responsibility onto others. Unsurprisingly, they then label me as mean for pointing out objective reality to them. Even while confessing to 8 murders, Wettlaufer still throws shade on professionals treating her as she works to create a narrative of a good nurse who isn't really responsible for what happened.
So I went on an online support group and was talking to people on there, and they were saying, get some help. So then I started researching some psych boards and stuff, and I saw CAMH, and they are the only mental health facility in Ontario that has an emergency department.
Okay.
So, now we have more offerings to the god of "it isn't my fault." After blaming stressful working conditions and voices which influenced her to kill, she now starts naming people she confessed to. The implication is they could have stopped her murders if they'd only reported her. This appears to be another attempt to shift responsibility.
So I made a decision, and I went there one Friday morning. I took the train, and off I went. And before I went, I told 3 people what was going on. My friend from AA, and my friend, I told them what was going on. They said, yes, go and get help. And my friend drove me to the train station.
And when you say you told them what was going on, did you get into details of why you were going to seek help? Or?
I told them that I had been killing people using an insulin overdose.
So did you disclose the same thing to all those 3 people?
That I had been giving insulin overdoses. I didn't say why, because at that point it felt so stupid. It just felt so stupid.
And
Wettlaufer is showing signs of beginning to become overly emotional. This would endanger the interview. The detective picks up on this and deploys the twin weapons of praise and reassurance to ensure Wettlaufer keeps the incriminating information coming. Everyone loves praise and reassurance, but individuals with ASPD, BPD, and NPD really love them. They thrive on them so much that they'll keep incriminating themselves in return for some short-term praise.
And Beth, to be honest with you, I admire the way that you're conducting yourself and telling us and having this conversation with me. I thank you for that. And I'm not here to judge in any way.
I know.
So I want you to know that. And I'm not a doctor. I know you spent a lot of time at CAMH the last 3 weeks, right?
Yeah.
And I'm far from a doctor, but I do appreciate you telling me the truth and telling me the way that these things happened and played out.
Yeah.
And I admire you for that.
Praise employed? Check. Reassurance that the detective isn't judging her? Check. Appreciation of truth-telling? Check. Note also the great use of open body language on the part of the detective. He's leaning forward, making good eye contact, using hands casually but openly, shaking his head in a timely fashion and in congruence with his verbal message. He just projects sincerity through every communication channel, and she buys it. This detective is well trained in interrogation skills, and it shows. I am certain he was handpicked to carry out this interrogation. Now let's keep digging. Wettlaufer continues trying to sell her narrative. She claims she is a caring nurse trying to meet the highest of possible standards. Only events out of her control for which she cannot be held responsible caused her to help people to die. She is trying to sell this with intense eye contact, increased spontaneity, rate and rhythm of speech, the paraverbal channel, as well as an almost continual deployment of the hand chops of sincerity. The detective isn't buying this act. While it might be satisfying to let suspects know you can see right through them, that would hamper the task of getting information from them. So while he sees through it, he doesn't challenge Wettlaufer.
And it's, it's been a while because I've been doing about, do I give the names of the people that I killed?
Right.
Because then here's 8 families who thought that their family member died peacefully and normally, and they didn't, and what's that going to do to those families?
Right.
And even up to going to the hospital, I decided I was just going to give the first names, and my cousin said, listen, they know what years you worked there. If you don't tell them the exact names, they're going to go in there and go over every single file, and that's going to be even worse for the families there.
Right.
So that she was the one to give me that advice, to give the names.
Okay. What medications are you on right now?
I'm taking fluvoxamine. It's called Luvox, 200 milligrams. It's anti-obsessional and an antidepressant.
Okay.
I'm taking 300 milligrams of Seroquel, which is an antipsychotic, and they upped that when I was at KNH.
Seroquel is an antipsychotic and best known for treating schizophrenia, but it is also very beneficial in those with anxiety or borderline personality disorder to help modulate their anxiety and emotional dysregulation. So Wettlaufer being on Seroquel is not a sign that anyone thought she was psychotic. It was almost certainly prescribed for anxiety and emotional dysregulation.
Okay.
Which has really helped clear my thinking.
Has it? Good.
And then I'm taking a couple of blood pressure medications, and then I've got some loxapine for when I get really agitated.
Okay. And when we left the hospital, you had taken, I believe, some Ativan, is that right?
I took 2 milligrams of Ativan when we left the hospital.
Right.
Which was, you guys noted the time, 1:30 or something like that.
Right. Yeah,
Yeah.
exactly.
And I've had nothing since.
This explains Wettlaufer's rather unusual lack of facial expression and relatively reduced nonverbal communication. She took 2 milligrams of Ativan roughly 4 hours previously. With a half-life of roughly 12 hours, this anxiety-reducing and sedating medication is still present in her body and brain. Ugh.
Okay. And I know that the Dr. Khan provided with a prescription that...
Yeah, and he also gave me 2 loxapine.
Yeah.
And was very strict. I am not to take them until all the interviews are over, because they will start to interfere with my thinking.
Okay.
And then let me see the interview.
Yeah.
The detective picks up on the possible impact of this medication on her fitness to conduct this interview. He recognizes the need to ensure that Wettlaufer hasn't taken them before the interview against the psychiatrist's advice. If she had, a clever lawyer could argue that she wasn't fit to be interviewed, and the information gathered so far might be ruled invalid in court.
Exactly. And do you feel that you're of a clear, sound mind right now?
Yes, I do.
Conversing with me in this room?
Yeah.
Okay.
Mhm.
And everything that you're telling me is the truth and the best that you can remember?
Yes. Yeah.
Task accomplished, bullet dodged. Now the detective wants to bring her written confession into play. He recognizes that this will precipitate a lot of anxiety on Wettlaufer's part. So he gets in some preemptive praise as well as a lot of sympathetic understanding of her situation, how it could have impacted anyone negatively, etc. He also asks permission to go over the document. This observes a social nicety, lowering tension and making this seem like a nice chat between 2 people who respect each other, instead of an interview gathering information to put Wettlaufer away for life.
I could appreciate where you're coming from as far as the work that you went through. Obviously, I've never been a nurse. I've never worked in the profession that you did, but I could imagine how overwhelming it is.
Yeah.
Having a lot of responsibility, maybe not having the support of the administration or your supervisors, just kind of go out and get it done, right?
Yeah.
And that could be, I can see how that would be stressful, and I can see how that would drive you maybe into your addiction and to other things. But I want to just go over this document, if that's okay with you.
Yeah.
Wettlaufer is very anxious when the written confession is introduced. Watch what happens now. She gets out of the chair, reiterates that she's a good person who has never been arrested before or even gotten parking tickets, paces up and down and touches the walls 3 times at the end of a circuit.
Okay, would you be willing to do that with me?
Yeah.
Okay. And you
Yeah.
do your thing.
Sorry.
No, don't be sorry. Absolutely not.
This is pretty major. I've only ever had parking tickets. I've never been arrested for anything.
Well, like I said, you're not under arrest
Oh,
right
I
now,
know.
but it is a very significant investigation. You're right.
I understand.
And like I said before, Beth, I do appreciate you speaking with us, and I can imagine that do you feel like a weight off your shoulders?
Yes. Yes,
You've been
it does.
carrying a burden for quite some time.
And I've tried to get help. That's it.
Yeah.
I see this a lot in my patients with OCD when we are discussing anxiety-creating topics. It is a form of self-soothing behavior designed to reduce internal anxiety. Given that Wettlaufer is diagnosed with OCD, this represents an OCD-mediated self-soothing behavior.
Yeah. Well, sometimes it takes a few attempts to finally commit to it, right?
Yeah, I had a pastor that I told him, he prayed over me and told me I'd be fine. Then that was God's grace, and then
When was that?
that was Halloween 2000.
And you kind of divulged to what had happened to you to that point in your life with
Yeah,
involving these people?
yeah,
Okay. And where was that?
that was here in town. Do you want his name?
If you want to tell me, it's up to you.
This is the 4th person Wettlaufer has stated she confessed to. Her narrative is clearly to establish that if only those individuals had contacted police, she wouldn't have kept killing. She is seeking to avoid taking full responsibility for her actions.
Oh no, sorry, it wasn't. Did I just say 2014? With 2013.
Okay. So before we get into this, I know that there's a statement which we have and that I've watched where you attended a police station in Toronto at
Yeah.
52 Division. Is that correct?
Yeah, that's okay.
And I think it was Detective Hamilton, and I honestly can't remember the other detective's name. I know it started with an A. And you met with them for, I was going to say about an hour and a half.
That was nuts.
Yeah. And at that point, you had in your possession a photocopy of this document.
Yeah, right.
And you went through and you read it out.
Yeah.
Okay. And then following that, they started with the first name on the list, and they wanted to just try and get a little bit more detail
Yeah.
of the involvement in each circumstance, in
Okay.
each death, right?
Okay.
That's what I'd like to do today, and just get some more detail.
The detective returns to the written confession. He begins laying the groundwork for going through it in detail with Wettlaufer. Note how reassuring he is saying,
I've got all the time in the world. I'm not going anywhere.
and how he uses inclusive language, we, instead of I.
I think we can get through it together.
All of this is to reinforce the rapport established earlier, to create an alliance, and most importantly, to ensure he can wring every self-incriminatory piece of evidence from her.
Okay.
Okay. So
It's a long list.
it is, but I think that you and I think we can get through it together.
Yeah, I'm sure we can. If only you're patient with me.
I've got all the time in the world. I'm not going anywhere.
Because I'm physically comfortable with a nice chair, but
Yeah.
Right.
Anytime you need to get up and wander around, if you, like I said, if you want to take a break and have me leave and just kind of stretch your legs and whatever the case may be, you go ahead.
okay.
Okay, if you have to use the washroom anytime, just let me know.
Alright.
Okay, because like I said, I'm here as long as we need to be.
Okay.
Okay, and I'm not pressuring you to stay any longer than you want to, but I think that if we just kind of sit down and go through this, like I said, we'll get through it together.
Yeah.
I'm a pretty patient person, and I'm here to just listen to what you have to tell me, okay?
Okay.
Okay, and like I said, I appreciate it. Okay? So, how about we just do this together? I'll just bring this over here, is that okay?
And yet another expression of appreciation. Not only is he patient and in this with her, but he is also very appreciative. He also does a very interesting thing by moving closer to Wettlaufer and placing the confession on the table under the pretext of having her be able to read it. He could have just handed it to her, but then she would have been able to hold the page up and use it as a barrier between them. That would have been a very negative development, which this simple stratagem has avoided. Not only has he prevented the confession being used as a physical and psychological barrier, but by his placement of the pages, he has forced Wettlaufer to turn her chair. Now, instead of facing each other, the chairs are at a 90-degree angle to each other. This is a much more collaborative setup. They aren't interrogator and murderer, but just two people working to get through it together. Very clever work carried out so casually, it wouldn't be noticed by most people. Entire sections of psychiatric training are devoted to room layout, and the angles made by the chairs of the psychiatrist and patient. I know I've very purposely set up my room so that my patients are at a set distance, at a set angle to me, unable to get to me before I can escape should they try to assault me, etc. It is all very purposeful and thought out, just like this detective's actions.
Sure.
Okay. So I'm not going to have you read through this entire document because you already did that, right?
I have written it. I have read it. I have, lived it. So.
Yeah, absolutely. So, Mr. Silcox.
Yeah.
Okay, September of 2007.
Yeah.
Okay.
The first one that died of resolve what I did.
Note again the verbal contortions Wettlaufer engages in to avoid saying, "the first person I murdered." She continues to use verbal semantics to avoid taking full responsibility for her actions. James Silcox was an 84-year-old veteran who worked at Standard Tube for more than 30 years and was married to his wife, Agnes, for 63 years. He had 6 children. He suffered from Alzheimer's disease and had a stroke in early 2007. He had had surgery on his right hip on August 4, 2007, and returned to the nursing home on August 10th. He died on August 12, 2007. Let's listen to Wettlaufer's version of events.
So, Mr. Silcox, it says here you were working a double shift from 3 till 7, right?
3 p.m. to 7 a.m.
Right. Okay. And this was at Crescent Care?
Yes.
Okay, in Woodstock?
Yes.
Okay. And tell me about your knowledge of James and your daily interactions during a shift with him.
I didn't see him every time. He wasn't always my patient. I just knew from what people had said that he would grab the nurse's breasts and buttocks, and he would say horribly inappropriate things about his life, that now he was there, he was going to fuck all of it. She was going to fuck all of Woodstock, and just was saying different things. And he did touch me inappropriately once.
And where was that?
On my breast.
On your breast, okay. And were you alone in the room at that point?
Yeah.
Okay. Did he have a roommate at all? Did James have a roommate?
He must have. He wasn't in a single room. So he was either in a double room or a quadruple room.
Okay. Would you remember any other residents that would be lived with him at that time? Or?
No.
No? Okay.
No.
That's okay. What portion of the home was James in at this point?
He was in the east wing, south wing, north wing. He was in the north wing, was halfway down, and he was either in a double bed or a quadruple bed.
Okay. All right. And the diagnosis of his health at the time you were caring for him, you remember?
He was post-hip surgery and he had dementia.
Do you remember how old he was approximately?
No, I don't. I'm in the 80s.
In his 80s?
Yeah.
Okay. And, sorry, he was not a diabetic?
Not a diabetic.
And, sorry, you said he had dementia?
Yeah.
Okay, which you've also noted here as well, right?
Yeah.
Okay. So tell me about the night. Was it the first person that you did this to?
That I tried. Well, there were other people that had done it to who didn't die.
Prior to James?
Prior to James.
Okay, and are they documented on here?
He's the first one who died.
Right.
Back here?
But there's some other
people who didn't die.
The detective has established that James Silcox was the first person Wettlaufer murdered, but that she had intentionally overdosed others before. Now Wettlaufer pivots back to her narrative of the voices influencing her and reducing her personal responsibility for what she did.
Right, so I can't read that first name.
Clotilde Adriana.
Okay, so that was, they're both September 2007, but that was before James?
Yeah.
Okay. So, was this your first attempt at overdosing these people on insulin?
Yes, all I was.
Clotilde.
And I didn't really want her to die. I don't know, I was just angry and had this sense inside me that she might be a person I thought wanted back with them.
Okay. And is that feeling you were referring to that you had in your stomach at times?
Yeah.
Okay. Is that the point, and I hate to get off topic here, but the point where you had these feelings in your stomach and almost that laughter after it happened.
Yeah.
Is that the part that you didn't tell Dr. Khan?
Yeah.
Okay. Okay. I just wanted to be clear on that.
I told him about the laughter in my stomach, but not the feeling that this might be the person that God wants.
Okay.
Because I just found it so stupid.
It's your feelings, right?
Mm-hmm. I honestly felt like God wanted to use me. And Dr. Khan kept asking me, do you think I was chosen for a special purpose? I kept saying no, because that did not sound like a special purpose, you know?
Yeah.
So, but yeah, I just had a sense after my marriage broke up that God was going to use me for something. And then after a while, I started to really wonder after some of the murders.
Note the turning of the head and gaze aversion, as well as the slight pause, followed by a rush to say the word murder. This is the first time that Wettlaufer has used the word murder, and it is clearly stressful and difficult for her to do so. The verbal, paraverbal, and nonverbal channels all agree that she feels shame about the murders. But remember that just because she feels shame doesn't mean she isn't still lying and manipulating throughout this interview, as we'll see later.
If it was God or if it was the devil fooling me.
Did you feel like you were doing the right thing for these two?
No. No. I felt like I was doing what I was supposed to do, but it wasn't what was right for them.
This is important. One of the foundations of most insanity defenses is that the killer didn't realize what they were doing was wrong. With this admission that she knew her actions were wrong, one of the keystones of any insanity defense is fatally weakened.
So James, then, it was in the evening that this one took place, right?
Yeah.
Because you're at about 9:30.
Yeah.
Run me through.
About
portion of
9:30, I gave him a dose of 50 milligrams of insulin, not diabetic. So I went into it. I used a borrowed insulin pen, borrowed insulin, and gave him an insulin shot. And at 3:30, the PSW, well, throughout the night he was yelling out, "I love you," and "I'm sorry." And that's not to me, but just you could hear him calling out in his room, and that's what he was calling out. And then at 3:30, the PSW came to me and said that he was gone. So I did what we're supposed to do. I went listened to his heart and chest, called the doctor, called the family because that's what they wanted. Family came in and sit with him for a while. Doctor came in and said that his cause of death was from an embolism due to his post-hip. He'd had hip surgery. Doctor ruled an embolism due to post-hip surgery.
An embolism in a frail 84-year-old post-hip surgery is not an uncommon cause of death. It fits the rapid deterioration that occurred. We must also remember that this doctor would have been covering many nursing homes and is unlikely to have reviewed James in detail previously. They would have been heavily reliant on Wettlaufer, the nurse in charge's reporting on what had happened when deciding the cause of death. Obviously, Wettlaufer would have spun a believable but false tale for the doctor.
Who do you think he was talking to when he was yelling out, "I love you"?
I thought it might be his family. I really did. And when they came in and talked to me, they wanted to know if he'd said anything. So I told them that I was so ashamed. So ashamed. Yeah.
When you were speaking with the family?
Yeah.
And is that the...
Again, the verbal, paraverbal, and nonverbal all agree that Wettlaufer is feeling shame. The times she talks about shame are the most truthful moments throughout this interview. In the rest of the interview, she shades the truth frequently and outright lies occasionally. An interesting section is coming up. Here, Wettlaufer uses one of the most common deceptive practices I see. Instead of outright lying and saying they did something they didn't, many people will throw out a potential action without actually saying whether they did or didn't do it. In this case, Wettlaufer states, "Maybe I fought with my girlfriend, did some exercise." She isn't actually stating that she did those things, just offering them up as things she may have done. Most people hear these statements and conclude that's what happened. In this case, I'd be willing to wager a lot of money that two things which absolutely did not happen were a fight with her girlfriend and exercise. Wettlaufer is lying to cover something up.
Yeah, the family that kind of commended you for the work that you had done. And
yeah, so that I didn't have for him, and yeah.
How'd that make you feel?
Awful. Absolutely awful.
How did you deal with it?
I just went home, went to bed. You know, I felt awful. Maybe I fought with my girlfriend. Did some exercising, you know.
Yeah.
Did some games on the computer and just tried to forget about it.
Did you have a problem sleeping at night at all, or anything like that, or did you?
Well, I was working nights, so I was,
during the day then?
I would say it's often turned a bit, yeah. Felt pretty bad. And I didn't want to see the family again. So I tried to make sure I wasn't working when I came to pick up his stuff, and I wasn't.
And what room? Do you remember like a room number, or just like?
No, it was down in our front.
The wing, yeah. Where did you get the insulin from for James, for Mr. Silcox? You said you had taken some insulin. Where did you get those?
The insulin was kept in the fridge, in the medication room.
Okay.
We had 2 medication rooms. Insulin was kept in the fridge in the medication room, and extra pens were kept in the drawer. So you could just say somebody had someone admitted you needed a pen in a hurry. So you just put the insulin in the pen and put the needle on and dial up the dose and give it.
And how was that documented? To know that, so that Crescent Care would know that you were taking that insulin?
They didn't keep track of insulin.
Okay. So it was just something that was available for the nurses to use when they knew that it was appropriate for the certain patients.
Yes, now each patient has their own insulin.
Right.
And maybe somebody may have noticed that a lot of insulin was missing if a lot was used, but I was always careful to use different people.
This is crucial. Wettlaufer was able to kill using insulin because at this time, insulin usage wasn't closely monitored and recorded. This was a critical vulnerability in the system which allowed her to kill.
How long after, when did you break up with your husband?
I broke up with
August
him.
2007?
Oh, no. I broke up with him in end of January, beginning of February 2007.
Okay, so it was quite some time till September until you actually...
Yeah.
All right, I guess.
By that time, I was in a new relationship with a woman.
Okay. Who was that?
Her name was Maureen.
Did you ever disclose to her what you were doing?
No, absolutely not.
So you just kind of went about your thing with Mr. Silcox?
Yeah.
Went home that day, did your kind of some exercise and computer games, went to sleep. Did you work again that next day?
I don't remember.
Do you remember who you would have been working with on that occasion?
No.
No?
No, I don't. I'm sorry.
Are you okay?
Yeah.
You want to get up and stretch?
I just do a lot of fidgeting.
Okay, that's okay. Hey, you're not bothering me. I just want to make sure that you're comfortable.
Yeah, I'm okay.
Okay.
If I need something, I'll do it.
Okay. You betcha. Do you remember who your supervisor would have been at that point?
Well, that would be Helen Young.
That was the head nurse.
This next section yields very important information. As the charge nurse, Wettlaufer was the clinical lead for the nursing home overnight. She was, in effect, the boss. The PSWs didn't have the clinical knowledge, experience, or authority to question her. The other registered nurse on duty was her subordinate, and so was unlikely to question her. The fact that she was the boss at night facilitated her murders and her getting away with them. And...
yeah, she was always, like, whoever was on as the nurse was the charge nurse. So I was the charge nurse. And at night, so as the charge nurse, from 3 to 11, I was in charge of 1, 2, 3, 4, 5, 6, 7, 8 PSWs. And I was and then there was 2 other wings. And so at night, as the charge nurse, I was responsible to look after the RPN on the other side, like be a researcher there.
Okay.
There were 4 PSWs on that side and 4 PSWs on my side, so 9 people.
Okay.
And then Mrs. Conley, of course, she wasn't around with me.
Okay. She's for days.
Yeah. But she's who we all answered to. She was, her and the executive director, Brenda, I don't remember her last name. I'm sorry, I'm probably gonna pass gas originally.
That's fine. Don't worry about it. So, as far as Mr. Silcox goes then, besides what you were feeling in your stomach, Okay, and besides that, you thought that this was a purpose that you were given on from your relationship forward after breaking up with your husband, right?
Yeah.
You indicated that he wasn't a very nice man.
No, he wasn't.
Is that a portion of what happened?
I don't know.
Okay.
I would have thought the portion of how I chose him, and afterwards I did feel a release and a relief, like a release of pressure.
Okay. Because throughout this document, and as we go through it, a lot of these people, you kind of describe them as not very nice people.
Yeah.
Right?
Yeah.
So I'm not sure if that's a tendency or a pattern that we see as far as, is that why you go in with people?
Yeah, I'm not, it might be, but I also know I just felt like they were the one.
Note that Wettlaufer doesn't outright deny that her personal feelings towards patients drove her to murder them, but hedges by saying she also had a feeling that they were the ones. Any potential insanity defense looks weaker and weaker with every such admission.
Right.
I had a feeling inside that they were the ones.
Before you injected insulin into Mr. Silcox, was this spur of the moment thing? Had you thought about it when you reported for duty at 3 o'clock in the afternoon?
I started thinking about it about 6 at night, I think.
Okay. And do you remember who the pronouncing doctor would have been?
No.
Like, how did that process work?
That process, the way it worked was, person in town with no vital signs. Nurse goes in with the stethoscope, listens for 1 minute. If there's no heartbeat, no lung sounds, nurse goes and calls the doctor on call.
Okay.
There was also a sheet that we had to fill out if we thought it was a coroner's case. In this case, I don't believe we thought it was. And then family is called. And the doctor may wait to come in and pronounce in the morning.
Okay.
Family can come in and visit the body at any time.
Okay.
So then the PSWs would get the body ready.
Okay. So prior to the doctor announcing in the morning, the family could come in and
Yeah.
spend time?
Yeah, so the PSWs would just clean them up, put on, put on clean breeches and
Right.
clean up the bed and stuff.
Right. So you said Mr. Silcox, you said we didn't think it was a coroner's case. Who's the
Oh.
What would that been?
I guess I'm using the royal we.
Okay, gotcha. Okay. So would that be just a decision that you were trusting?
No, there's a form
Okay.
on the computer, and you go down through it, and if you tick off anything that says yes, you notify the coroner.
This is intentionally misleading. I've been the on-call doctor to various long-stay and nursing homes during my career, and when you're called to pronounce someone dead, it would be someone you'd never seen before. In those cases, the charge nurse would present a summary of the case to aid in deciding whether or not it was a coroner's case. In this case, the charge nurse, Wettlaufer, who murdered the patient, clearly didn't want the coroner involved, and so shaded the case summary to avoid a coroner becoming involved. Note how she used the royal we, not thinking it was a coroner's case when, as charge nurse, it was very much her call in reality. She's presenting partial facts to create a narrative favorable to her, and outright lying throughout this interview. She's hoping that the detective won't know enough about how the medical world works to pick up on these things. Unfortunately for her, this detective has done his homework, or as Reed terms it, case fact analysis, and has clearly been handpicked for this interview because he's very good at his job. He can see right through her. Let's watch how he pins her down in the next section.
Okay. All right. But you would have clicked off those boxes yourself?
Yes.
Okay. So obviously, knowing that you had done this to Mr. Silcox, did you feel that you wouldn't click yes so that attention wouldn't be drawn to you?
You know, I honestly can't remember if he was a coroner case. You might ask him.
Now with insulin...
Even though I did that to these people, when I did their, let's see, it's phrased as, does anyone have a reason to believe that this death was not natural?
Right.
So yeah, I wouldn't click that one. If I had done anything. Yeah,
Okay.
you're right.
Okay. All right. And I just wanted to clarify that.
Yeah.
Wettlaufer dodges, ducks, dips, dives, and dodges, but the detective is too good for her. It was a royal we. There is a form. You have to call the coroner if you tick any yeses on the form. But you would have clicked off those boxes yourself. This is a rationalization to explain her intentional covering up of her murder. Since no one had a reason to believe the death was not natural, she clicked that it was natural. At this point, it is clear that while she is here to confess to 8 murders, she is going to lie as much as possible to avoid taking personal responsibility for those murders. She also appears to be trying, poorly, to lay the foundations for a possible insanity defense. Maurice Granat was an 84-year-old man. He was a tinsmith and ran a small shop where he fixed devices for people. He had cancer and intermittent delirium. He did not have a dementing illness or diabetes and had no need for insulin. He died on the 23rd of December, 2007.
Maurice, how did you pronounce Maurice's last name?
Granat.
Is it Granat? Okay. So tell me a little bit about Maurice. It says that this occurred in September or October of 2007. And this was at Present Care?
Yep.
Okay, tell me a little bit about your interaction with Maurice.
He was another one who liked to grab breasts and asses.
Okay.
He was sometimes a patient of mine. See, at that time, I didn't have a set floor that I worked on. I worked on all the different floors of the nurse. I was filling in.
Okay.
So, one afternoon I was working with him and he did grab me. And again, I got that feeling inside that this is his time to go. So I gave him an overdose of insulin after supper.
Again, the feeling that God wants someone to go to heaven comes after that someone does something Wettlaufer dislikes. She simply can't admit and take responsibility for the fact that she murdered people out of anger.
The next person on your list is Helen Matheson.
Yeah.
Helen was a 95-year-old lady who had lived in Ontario most of her life. She was active in her church, and she and her husband had 2 sons. She had dementia and other medical issues, but did not have diabetes and did not need insulin. She died the 27th of October, 2011.
Okay. So you go from September or October to 07.
Yeah.
And then Helen was 2011.
Yeah.
What happened between those years?
I think you'll see that
Was there some attempts in 08, 09?
Yeah.
Okay. Okay. And we'll get to those.
Yeah.
Okay.
Helen, I don't remember a lot about. She was very quiet, very determined. Just seemed to be waiting to die.
Mm-hmm.
Again, I had that feeling that, this is the one.
Mm-hmm.
And I made a bit of a fuss about her that night because she was very lucid.
Mm-hmm.
And we talked about how much she liked blueberry pie and ice cream.
Okay.
So on my break, I went to Walmart. I got a small blueberry pie and some ice cream
Mm-hmm.
and brought it to her. And she ate 3 or 4 bites.
Nice.
And then that night I overdosed her. 'Cause, like I said, I had that feeling that it was her time to go, and
What do you mean by that? Do you think she was towards the end of her life at that
I
point?
know that she was the person to go to.
The language used. She was the person to go next. It was her time to go. The detective wants to be clear that these aren't expressions that Helen was actively dying or palliative. He clarifies that these are merely expressions of Wettlaufer's formed intent to murder Helen. Wettlaufer feels it important to draw attention to her buying Helen her favorite blueberry pie after deciding to kill her. She's trying to shape the narrative to highlight her kindliness and what a good nurse she tries to be.
And you said once you gave them their insulin,
I tried to stay away from it. Sometimes I was very interested to see what was happening. I would just try to stay away from it.
This is very common among serial killers. They are often fascinated by any investigation into their murders.
would you ever go back into their rooms while they were still alive to see kind of how they were progressing through the...
If they were my charge, yes, I had to.
Even though you had attempted to take their lives?
Yeah.
Mary Zurawinski was a 96-year-old lady who worked as a waitress, was married, and had 4 sons. Sadly, her husband and 3 of her sons predeceased her. She suffered from dementia and other medical conditions but did not have diabetes and did not need insulin. She died the 7th of November, 2011.
She was feisty.
Was she?
Yeah. Didn't hurt the nurses or anything. She was just very outspoken and feisty, and one night she said, I'm going to die tonight.
Married to that?
Yeah. And I said, oh. And she said, yeah, why don't you get me into the deathbed so I can die? And I said, are you sure? And she said, that's what we said, I'm going to die. So I said, okay, and I went to the other nurse that was working with me. And she said, oh, okay, well, let's put her inside this care room if that's what you want. So we did, and then I thought, well, she must be the next one. I had a feeling inside of me she must be the next one. Because she was saying she was going to die, but there was no sign she was going to die. So I gave her an overdose of insulin. And she became hiatus and she died.
Note how what Wettlaufer wrote in her confession about Mary annoying her through her outspokenness and being angry in general is not reflected in what Wettlaufer says to the detective. The story is already being curated. Note also the passivity of she died the next afternoon. Not, I killed her, or she died after I injected her with insulin, but just a statement of the fact of her dying. Again, these are little word games to shirk responsibility.
Sure.
Which one has the vodka in it?
Imagine making a joke about vodka in a police station while you're confessing to murdering 8 people, and you have a background of drug and alcohol abuse. This shows the true Wettlaufer, lacking in insight and empathy.
Like I said, I admire you for whether it took 1 year, 2 years, 10 years, whatever it took for you to finally get help. That's a big step.
Oh, thank you.
Right? I mean, you could have been in this situation and taken this to your grave.
Yeah.
And who would have known? Right?
Wettlaufer highlights a 5th person she confessed to.
That's what I was hoping to do by a lawyer.
What's that?
Take it to my grave and not tell anyone.
So you confided in a lawyer as well about this?
A long time ago, yeah.
Was it after all of these people?
It was in 2014 before
Before you went to Welland? Or,
yeah,
or to
the Welland
rehab center?
Yeah, to the rehab center.
So you spoke to a lawyer?
Spoke to a lawyer that she was the one who told me to get out.
Gladys Millard was an 87-year-old lady who had 2 children with her husband and was active in her church and various charities. She had Alzheimer's dementia and other medical issues. She did not have diabetes and did not need insulin. She died the 14th of October 2011.
She had dementia, didn't take her pills well, didn't eat well, very stubborn woman. And as always, one evening I just got that red surging feeling that she was going to be the one. And gave her insulin overdose.
Did you ever get that feeling outside of work?
No, never.
No. Did you ever get that feeling going to work, knowing that something was going to happen at shift?
No, it always happened at work.
So, if I were to use the phrase spur of the moment, would it be something that you just have that feeling come on? Or
yeah, I guess you
would
could
it
say
build up?
spur of the moment, but it usually started happening, focused on one patient, and then I would feel that red surging, which is what made me think it was God. Which I'm so embarrassed.
Like I said, I'm not here to judge you. Do you think, did she have a reaction when you injected her?
She fought a little bit.
Did she?
Yeah.
What do you mean by that?
Like she struggled around, so I kind of fought on her leg that I could do where she couldn't reach me and pinch me.
Would that be something typical if you were giving her medication? She'd like
Yeah.
you to pinch?
Pinch.
Do you think that played into any part of your actions with Gladys? Particularly with Gladys?
I don't know, I think some of it did, the stubbornness with stuff, and yeah, just kind of, okay, you're the next one to go. But again, there was always that red surging that I identified as God telling me, this is one. This is how you work for me.
Wettlaufer again raises elements useful to a future insanity defense whilst admitting that at least part of her motivation for murder was annoyance. Here Wettlaufer admits hydromorphone abuse while working. This would have greatly impaired her judgment and impulse control. I believe this was an attempt on her part to establish some element of diminished responsibility due to intoxication.
Did you ever go to work intoxicated by alcohol or drugs at all?
No.
Did you ever use at work?
Yeah.
The hydromorphs?
Yes.
Often?
Probably once or twice a week. Yeah.
Helen Young was a 90-year-old lady originally from Scotland. She served during World War II, which is how she met her husband. After they married, they returned to his native Canada. They had no children but loved animals and traveling, After a bad fall, Helen couldn't live independently and moved into the nursing home. She had dementia and diabetes. She died on the 14th of July, 2013.
And Helen was type 2 diabetic with dementia?
Yes.
Okay. Tell me a little bit more about Helen.
Helen was miserable. She frequently yelled out, "Help me, nurse." She frequently yelled out she wanted to die. She just was not happy with her life. She would wheel around in her wheelchair saying, "Help me, nurse, help me, nurse, help me, nurse, help me, nurse." And when you went to help her, "What do you want help with?" "Nothing. Get away with me. Go away. Help me, nurse, help me, nurse." Didn't want to eat, didn't want to drink. Very difficult to deal with. Constantly would yell out, or we'd say, "What do you want help with?" "I want to die. Why can't you help me die? I want to die." And one night, it was like something snapped inside, and that red sturge came back, and I thought, okay, you will die. So, I gave her a shot. I came up to her and said, "This is for your pain." I gave her a shot of long-acting or short-acting, and she started to settle down. And then later on, we put her into bed, and I gave her more of the insulin. I think it was long-acting. She had a seizure. She turned red. She was diaphoretic. The PSWs called me to the bedside. I took all of her vital signs, and I pretended to take blood sugar. And said, "Oh, it's normal. Don't worry about it."
How did you go about that with people beside you?
There's you. Don't let anybody see that part of the...
PSWs?
Note that when Wettlaufer remembers Helen's wheelchair, she makes the motions of using a wheelchair with both hands. This sort of physical reenactment is a powerful indicator that a memory is truthful. She does this again when talking about giving Helen insulin. Wettlaufer's right hand mimics pushing the plunger on the insulin pen. To be fair, Wettlaufer isn't wrong that personal support workers wouldn't be familiar with medications and wouldn't be questioning the charge nurse. However, it is one thing to objectively state limitations of training and experience, and another thing entirely to say it whilst having total disdain on your face and dismissal in your voice. Immediately, Wettlaufer realizes that she has shown her true colors and asks that portion of the video to be withheld. In reality, this is an insight into how Wettlaufer views others with disdain.
How did it make you feel after those few years that these urges and these feelings had come back?
I felt horrible. I felt angry at myself. I felt like I had failed myself. I felt like God had failed me.
She is angry at herself, but also at how God had failed her by making her kill again. Yet another example of Wettlaufer seeking to diminish her personal responsibility for her own actions.
Did you have any other personal feelings in your mind as far as knowing that it was between right and wrong again?
Yes, I knew the difference between right and wrong. But I thought this was something that God or whoever wanted me to do it. And starting at that point to doubt that it was God. Maureen was a handful.
Wettlaufer is trying really hard, but she keeps on blowing holes in her potential insanity defense. Admitting you knew the difference between right and wrong doesn't help an insanity defense. Maureen Pickering was a 78-year-old who had no children. After her husband passed away, she loved spending time in the heat of Florida before her health declined. She had Alzheimer's disease and other medical issues, but did not have diabetes and did not need insulin. She died on the 28th of March, 2014.
She would attack other patients. She would pull their hair. She would hit them. She would pinch them. Eventually, it was decided that she needed a one-on-one staff. So sometimes they would book an extra PSW to be with her. Sometimes someone would come from the outside to be with her. But when one wasn't available, it was the role of the charge nurse.
Okay.
And that was nuts. Sorry. That's just absolutely nuts.
A one-to-one. Special means that a staff member sits with the patient, either within arm's reach or within eyesight, in order to prevent these behaviors. Note how disgruntled Wettlaufer is about it being her job if no one was available for one-to-one. This disgruntlement marked Maureen Pickering for overdose.
So, she just got harder and harder to look after, and one night when I had to look after her, that was the idea. I thought, I started getting the feeling that surge again. I thought, no, I don't want her to die. But if I could somehow give her enough of a dose to give her a coma or something to change her brain waves, maybe make her less, maybe make her less mobile, hard to handle, left handle, hard to handle.
Right.
So, yeah, I overdosed her.
Now Wettlaufer relates that she didn't want to kill Maureen. Instead, she wanted to cause irreversible brain damage and potentially put her into a coma to make her less of a bother to Wettlaufer. Thinking that if someone really annoys you, it is okay to kill them or induce a coma is psychopathic thinking at its finest. Arpad Horvath was a 75-year-old who ran his own tool and die business for 50 years. He was proud of his Hungarian heritage, and he and his wife had 2 children. He had dementia, a number of other medical issues, and diabetes. He was treated with oral medication and did not need insulin injections. He died on the 31st of August, 2014.
He was mean. He would grab the nurses and these PSWs, whenever they were trying to do things for him, he would grab them, he would twist their arms, he would punch them. Very difficult to do care for. And one night I just stopped that surgery and I thought that you need to go.
Had he done something that night?
No, not really, just been his normal self. And he fought the first needle. When I left for the night, he was still okay. When I came back the next day and worked, they said that he had had a stroke, severe stroke, and gone to the hospital.
And what made you prepare this document?
The doctor suggested to me that I should.
Okay.
Not to give to the police, but he said that if I wrote it out, it would be a good part of my therapy.
Okay.
So.
Okay.
And did take a large amount of pressure off me and helped me to really clarify the fact that no, it wasn't God, it was something wrong with me psychologically that was making me believe that it was God.
Another example of Wettlaufer dodging responsibility, blaming a psychological problem for her behavior, and refusing to accept that she mostly just murdered people who annoyed her so they'd stop annoying her and she'd feel less stressed. How did this happen? Elizabeth Tracy. May Wettlaufer was born in 1967, while her parents studied in Bible college in Toronto. Her family were devout, and her father was a lay pastor. Wettlaufer realized she was bisexual in her early teens. This put her in conflict with her family. Later, she enrolled in Bible college at London, Ontario's Baptist Bible College. After attending a gay-friendly church with her girlfriend, she was kicked out of college, and her older brother stopped speaking to her. Her parents sent her to conversion therapy, a spiritual intervention program that attempts to change participants' sexual orientation. These programs have been shown to be ineffective. Those who attend these programs also have higher rates of depression and thinking, and afterward. At present, in Canada, there are efforts to pass legislation to ban conversion therapy. After she completed the conversion therapy program, she was allowed back into college. Her brother never fully reconciled with her. After completing her studies at Bible College, she enrolled in a nursing program at Conestoga College. While she did well academically, she began to drink more frequently and more heavily. She also stopped attending church. She completed a nursing placement during her final year of training at Geraldton District Association for Community Living. In 1995, she took on a part-time position in the local hospital. She began taking medication from the hospital's medication room. She took Ativan, Valium, and even a dose of morphine a patient refused. One night in September, while at work in the hospital, she swallowed 30 milligrams of Ativan. This is equivalent to approximately 5 times the maximum daily dose. She became intoxicated and sedated, and was seen stumbling around and slurring her speech as she continued to administer medication to patients. Another nurse took her to a hospital bed to sleep it off. Later, she was admitted to the hospital for treatment for several days. Once well, she was discharged and fired. The Ontario Nurses Association, ONA, arranged counseling and an alcohol treatment program. It also placed Wettlaufer on temporary incapacity leave. They disputed the terms of her firing, and the hospital agreed to amend her file to say that she resigned for health reasons. The hospital agreed not to mention her substance abuse or behavior on the ward to potential future employers. The ONA imposed conditions on her license, stipulating that Wettlaufer must stay sober in order to practice, but this condition lapsed after 10 years. Wettlaufer obtained a position at Christian Horizons. This was a 5-bed group home for individuals with disabilities. She was employed as a personal support worker, instead of as a nurse. Because of her nursing background, she was encouraged to teach other employees about administering medications. She was made responsible for ensuring patients received their correct medications, doses, and for informing the pharmacy when medication supplies were running low. She attended addiction groups as well as an addiction counselor. She began attending services at South Zorra Baptist Church, where she met Donnie Wettlaufer. They married within a year, and Wettlaufer achieved a level of stability over the next few years. However, by 2006, things had disimproved. Wettlaufer began fantasizing about killing patients, her psychiatrist and co-workers. She was also secretly reaching out to other women online to form romantic relationships. During her time at Christian Horizons, Wettlaufer received numerous warnings about medication errors. She was suspended for 1 day while she was investigated for emotionally abusing patients. In June 2006, she took a leave of absence from work and was admitted to the Woodstock Hospital Psychiatric Unit for 2 weeks. While there, she was diagnosed with depression and borderline personality disorder. She was prescribed fluvoxamine, an antidepressant, and quetiapine, an antipsychotic. Quetiapine is often used to limit the emotional ability of those with borderline personality disorder. In this case, it was not used to treat psychosis. Wettlaufer later quit Christian Horizons. In early 2007, her husband discovered an online relationship Wettlaufer was having and began divorce proceedings. By September 2007, her girlfriend had moved herself and her 2 children to Woodstock to be with Wettlaufer. This girlfriend suffered from Parkinson's and was unable to work. This meant Wettlaufer was now the breadwinner for the family of 4, a significant increase in responsibility and stress. She couldn't apply for her old job as Christian Horizons had a policy against hiring people in same-sex relationships. Therefore, she applied for a position at Carasant Care. She was hired and moved from working in a 5-bed group home to being one of the senior registered nurses at Carasant Care. In this role, she had responsibility for 32 patients during her daytime shifts and all 163 patients, as well as a junior registered nurse during her nighttime shifts. This was a massive increase in professional responsibility. This increase in responsibility, coupled with Wettlaufer's poor coping skills, led her to become overwhelmed at times. She began abusing alcohol and medication again, as well as fantasizing about killing patients. Soon, these fantasies turned into reality. A number of bizarre incidents would occur which, when viewed with the benefit of hindsight, were ominous. She began skipping shifts. She made numerous medication errors. Another nurse found her standing over a palliative patient, whispering in a high-pitched, childlike voice, "If you want to let go, it's okay. Your family will understand. Your time is here. See the light." She came to work dressed as the Grim Reaper at Halloween. She behaved inappropriately towards staff and teenage volunteers, becoming known for asking some of the teenage volunteers to come home with her. In 2014, a serious medication error, which left a patient in severe pain, led Carasant Care to fire her. The ONA again represented Wettlaufer and had her firing changed to a voluntary resignation on her official record. It also had her employment file sealed, secured her $2,000 and a letter of reference. The next month, Wettlaufer was hired by Meadow Park Long-Term Care, another local nursing home. Wettlaufer's morphine abuse escalated, and within a few months she resigned from Meadow Park Long-Term Care. She spent several more weeks in Woodstock's psychiatric unit and then took 2 jobs, one with Lifeguard Home Care and the other with St. Elizabeth Care. Lifeguard deployed her to fill in at 7 different facilities, while St. Elizabeth provided home care to multiple individuals in their own homes. The trigger for her confession appears to have been her manager in St. Elizabeth Healthcare, advising Wettlaufer that she was going to be assigned to care for diabetic children. She resigned, later stating that she didn't trust herself not to harm them. After resigning, she checked herself into the Center for Addiction and Mental Health, CAMH, in Toronto. While there, she confessed her murders during a Facebook chat with an old friend. This friend contacted the police. While in CAMH, she confessed to her treating psychiatrist, who also informed the police. Over the course of a 2-decade career in healthcare, Wettlaufer amassed over 130 complaints and was fired several times. She had confessed to at least 5 people before her final confession. Her first confession was in 2008, when she told a girlfriend that she had killed 2 patients with insulin overdoses. Her girlfriend responded, "Don't do that anymore, you don't want to get caught." She didn't report Wettlaufer. Her second confession occurred when she told one of the teenage volunteers at Carasant Care that she had murdered several patients. This teenage volunteer ended their friendship, but didn't report Wettlaufer. Her third confession occurred 2013, when she told her pastor that she had killed patients. The pastor took her hands, prayed with her, and said, "This is grace. This is forgiveness. But if you do it again, we'll have to report you." The pastor didn't report her. Her fourth confession occurred in 2014, when she told an ex-boyfriend about her crimes in a text message. He replied, "Why don't you stop being a nurse? Why don't you change your job so that you don't have the opportunity?" The ex-boyfriend didn't report her. Her fifth was to a longtime friend over Facebook chat in 2016. Following her confession to police, Wettlaufer was charged with 8 murders on October 25, 2016. On the 13th of January 2017, she was charged with an additional 4 counts of attempted murder and 2 counts of aggravated assault. She waived her right to a preliminary hearing and pled guilty to all charges in court on the 1st of June 2017. Wettlaufer was sentenced to 8 concurrent life terms with no possibility of parole for 25 years on the 26th of June 2017. In January 2018, Wettlaufer admitted to staff at the Grand Valley Institution for Women that she had harmed 2 additional residents that she had not previously admitted to. She admitted to having smothered a patient with a pillow in a care home. The patient survived the attack. She also admitted to police that she had injected another patient, 77-year-old Florence Beadall, with a small amount of insulin. Florence died some 90 minutes later, but there was no evidence to prove that the insulin injection led to her demise. Florence was not diabetic and did not require insulin. This shows that throughout her supposedly candid confession, Wettlaufer was withholding information. Statistical analysis of patterns of mortality in nursing homes Wettlaufer worked in suggests that it is likely she killed more than the 8 murders she confessed to. This is not unusual. It is estimated that at least 35 Americans per year are killed by healthcare serial murderers. This is almost certainly an underestimate, as many go uncaught, and many who are caught are convicted of fewer murders than they confess to. In many ways, Wettlaufer is a typical healthcare serial murderer. 86% are nurses, and the majority are female. Approximately 70% of murders occur in hospitals, with the majority of the rest occurring in residential homes or long-term care facilities. Injected medications are used 52% of the time, with orally ingested medications in suffocation, smothering, forcing fluid into the lungs, etc., comprising most of the rest. The Ontario Court of Appeal Justice Eileen Gillespie oversaw a 2-year public inquiry into how these murders came to pass. She released a 4-volume report spanning over 1,000 pages in mid-2019. In total, there were 91 recommendations, of which 18 had been implemented by mid-2020, when COVID slowed their implementation. Elizabeth Wettlaufer remains incarcerated. Wettlaufer psychiatric diagnoses include borderline personality disorder, polysubstance abuse, and antisocial adult behavior. It seems likely that the only reason she was not diagnosed with antisocial personality disorder is because that would have required a diagnosis of conduct disorder as a child, and despite behavior, which looks like it would meet the criteria for diagnosing conduct disorder being documented from her adult remembrances, this diagnosis was not made at the time. So what drove Wettlaufer to kill? While it is likely that Wettlaufer was a psychopath, it doesn't appear that psychopathy drove her to kill. Instead, her choice of victims appears to have been linked to a sense of being overwhelmed and distressed by their behaviors. These behaviors frequently arising out of a dementing illness or delirium. When distressed and overwhelmed, Wettlaufer would have the utterly understandable desire to not be distressed and overwhelmed. Whilst most of us would address that desire by taking a break, seeking support from coworkers, or just soldiering on knowing that the patient's behavior is a result of illness, Wettlaufer's likely psychopathy allowed her to view killing, or putting these patients into a vegetative state in order to lessen their distressing behavior, as an eminently reasonable solution. Their lives were worth less to her than a reduction in her distress and sense of being overwhelmed. As such, we feel that her borderline personality disorder drove her desire to remove her distress through murder, and her likely psychopathy enabled her to carry through on that desire on multiple occasions. Did she commit additional murders? Serial killers like Wettlaufer rarely divulge everything they know or have done. Holding something back can give them a sense of control and power. Since this supposed full confession, Wettlaufer has admitted 2 further attacks with a statistical analysis of patterns of mortality indicating that she is likely to have killed another 8 patients, making for a total victim count of 16. We believe that the number of her victims being 16 is far more plausible than just the 8 she was convicted for due to the following factors. 1. Research shows that healthcare serial murderers are rarely convicted of all of the murders they are charged with. 2. Research shows that healthcare serial murderers often later admit murders in addition to those they were convicted of. 3. Statistical analysis usually implies far more victims than they either confessed to or were charged with. 4. Wettlaufer's psychopathology is such that a sense of control and power over others would likely be quite attractive to her. Holding back information would provide that sense of control and power, as would providing information about additional assaults or murders over time. Each time she does so, she garners attention and a sense of further power and control. We expect that this is a very seductive motivational factor for her at present and into the future. We hope you found this analysis, Elizabeth Wettlaufer's Interrogation and Crimes, interesting. It is important to clarify that we have never personally assessed Wettlaufer, and so cannot formally diagnose her. We are reliant on the diagnoses of those psychiatrists who assessed her at the time. We have then interpreted these diagnoses, clinical reports, a thorough review of Wettlaufer's trial, and the Canadian public inquiry through the prism of our clinical and forensic experience, and the published research into serial killers. In this case, we particularly relied upon the research into healthcare serial murderers. If you'd like to find out more about profiling of serial killers, we have provided you with links to books by Robert Ressler and John Douglas of the FBI Behavioral Science Unit, and Fred Inbow regarding the Reed technique for conducting interrogations. These are affiliate links, so if you purchase through them, we'll receive a commission which we'll put toward creating more and better content. I've also included a list of relevant references, as well as the Canadian Long-Term Care Homes Public Inquiry reports in the description below. Please leave any comments or questions in the comments section, and we'll do our best to answer them. If you'd like to be notified when we release videos, remember to subscribe and hit the bell icon. As always, take care of yourselves and each other.